A leading neuro-radiologist from India talks about CCSVI, a new experimental treatment for multiple sclerosis. The doctor has over 50 scientific publications, has fellowships from France and Paris. He is also a visiting professor at the University of Massachusetts in Boston.
We are getting patients from all over the world, many patients from Canada, where I think there is very high level of interest. We have treated patients from United States of America, Britain, Netherlands, Mauritius. So there are patients actually which are coming among various different parts of the world to our center for this purpose. I will divide the feedback into two parts. One is the feedback of what we do in the terms of that how we have performed the procedure, how their information and their short-term outcomes. That way I think we have had I shouldn't say myself, but I think we have had a tremendous positive feedback. And not in the terms of long-term clinical outcome, I think we are still awaiting. We have seen quite a few patients showing immediate improvements, which has come as a pretty pleasant surprise to us. But still we are awaiting and we are following up our patient long-term to know exactly how much is the benefit to the patient and how will they behave in the longer term. Okay, what we have formed is we have formed a team to study CCSVI or the liberation treatment. And we have formed a very clear protocol how we are going to evaluate. So we just don't want to do the procedure, we want to do a complete clinical evaluation and radiological evaluation, and not only do the liberation treatment but provide any other help we can give to these multiple sclerosis patients, including advices for physiotherapy or any other medication change. So we are doing complete Doppler, including transcranial, the brain Doppler studies, pre and post the procedure, MRI venography, and of course pre and post clinical evaluation of these patients with absolutely the latest technology which one can have anywhere in the world. And we have got dedicated neuro ICUs, we have got Medina Institute of Neurosciences with a big team of neurologists, neurosurgeons, neuro-radiologists and neurointerventionists. And we are backed by the latest imaging equipment such as 3 Tesla MRI, transcranial Doppler, neck Doppler studies, and a biplane dedicated neuroangiography system, which is a great help in performing these procedures. All of us have to be very optimistic but in a guarded manner. That's what I would say. I mean, on the one hand, as I told my patient, if I had multiple sclerosis which was progressing, I would myself probably give this a try. But that's what I mentioned, a try. One has to still understand that this procedure is still being studied and we are awaiting long-term. This is what I tell all my patients, that okay, they can be optimistic, but we have to still wait for a long while before we are 100% sure how much is really the benefit going to be. But we are feeling very positive because if we are able to prove this is working, this can be a tremendous advance for the patients suffering from multiple sclerosis.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.